Have you ever wondered which diseases cause the most deaths worldwide? A question that might seem grim, yet it's an unavoidable reality we need to face. We're living in a time of a global health crisis that's been silently taking lives. Topping the chart of these silent killers are cardiovascular diseases, the stealthy assassins that strike when you least expect. They're responsible for a significant chunk of fatalities around the globe, from heart attacks to strokes. But let's not forget about respiratory diseases. Conditions like chronic obstructive pulmonary disease and asthma, they're like the unseen enemy, slowly and methodically attacking the essence of life, our breath. Then there are lower respiratory infections. Pneumonia and bronchitis, they're the third major player in this grim lineup. They might seem common, yet their impact is anything but. Each of these diseases, in their own way, contributes to the mounting global health crisis. But why are these diseases still such a major issue in today's world? The numbers might surprise you. When we dive into the data, it becomes clear that some diseases cause a disproportionate number of deaths worldwide. Let's consider some recent statistics. Heart disease is the leading cause of death globally, with nearly 18 million lives lost each year. Following closely behind is stroke, which claims almost 6 million lives annually. Lower respiratory infections, lung diseases, and Alzheimer's disease round out the top 5, each causing between 3 and 4 million deaths per year. Now let's take a geographical tour. Heart disease is the #1 killer in both the United States and China, the world's two most populous countries. However, in India, the third most populous country, the primary killer is lower respiratory infections. Africa tells a different story, with HIV/AIDS causing the most deaths in countries like South Africa, and malaria being the leading cause of death in countries such as Nigeria. But the numbers don't tell the whole story. There's a stark disparity between developed and developing countries when it comes to these diseases. In developed countries, non-communicable diseases like heart disease and stroke are the leading killers. These are often diseases of lifestyle linked to factors like diet, exercise, and smoking. In contrast, in developing countries, communicable diseases like HIV/AIDS and malaria are more prevalent. These are diseases of poverty, linked to factors like lack of access to healthcare, poor sanitation, and malnutrition. In essence, where you live can determine what diseases you're most likely to die from. This isn't about geography, it's about inequality. It's about the fact that in the 21st century, millions of people are still dying from diseases that we know how to prevent or treat. So, what's stopping us from finding effective solutions? Finding a solution isn't as straightforward as it might seem. This is the harsh reality when it comes to tackling the world's leading diseases. We are up against a wall of challenges that are as complex as they are numerous. Firstly, there's the issue of funding. It's no secret that developing treatments and vaccines require significant financial resources, but the pool of available funds is often woefully inadequate. This lack of funding is particularly pronounced in low-income countries where the majority of these diseases are rampant. Then, we have the problem of access to healthcare. Even when treatments exist, they are often out of reach for the people who need them most. In many parts of the world, healthcare facilities are few and far between, and the costs associated with treatment can be prohibitively high. Lastly, we cannot overlook the role of socioeconomic factors. Poverty, lack of education, and inequality all contribute to the spread and persistence of these diseases. These factors are deeply rooted in our societies and cannot be ignored when looking for solutions. These challenges are daunting indeed. They require us to rethink our approach to healthcare, to find innovative ways of funding research, and to ensure that treatments are accessible and affordable for all, regardless of where they live or how much they earn. But there's always hope for a healthier future. Because despite these challenges, we have the power of human ingenuity, the resilience of our communities, and the unyielding spirit of those dedicated to making a difference. Together, we can and will overcome. You have the power to make a difference. By simply hitting that like button and subscribing to this channel, you're helping to amplify the message. It's about more than just staying informed. It's about sharing knowledge, sparking conversations, and raising awareness about these pressing global health issues. With every view, Every share, every discussion, we're chipping away at the silence that often surrounds these diseases. Together, we can contribute to a healthier world. Thanks for watching.